Good morning, Carol Johnson.
Good morning, Bob Ponce. How are you?
Good. We made it through the night, and we're here as we always are on Wednesday morning.
Yes, and it was a relatively calm night, from what I understand.
Yes, and it's a
Um,
Wednesday morning like every other Wednesday morning.
yeah, yeah,
so
but it's all good. It's all
it's
good.
all good. It's all good. So we're here to talk about COVID-19 update. Our lead story is the fact that in Harlem, COVID rates have been going up, and we wanted to alert people, obviously, to that. Quoting from an article in Patch, that most Harlem zip codes have seen an uptick over the last 4 weeks. 6 out of 8 of the Harlem zip codes are up. The zip code with the highest rate is 10031, which is West Harlem, Hamilton Heights, where 2.1% of tests came back positive. That puts it in one of 67 zip codes around the city with a positivity rate above 2% over the last 4 weeks. And there are 16 that are above 3%. So we don't have any in the 3% range. So that's better news that we're not as bad as other places, but the fact is that it's going up, and it's again, this is a sign for us to be more alert and get back on our game in terms of social distancing, mask wearing, washing hands, all those things. When we see these numbers inch up, we want people to understand that this is the time that you've got to pay close attention. The only zip codes where the positivity rate decreased were 1027, which is Central Harlem, Morningside Heights, and 10037, which is Northeastern Harlem. Um, East Harlem saw a significant jump, 1035 zip code. The positivity rate more than quadrupled from 0.37 to 1.53, and it also more than doubled in Central Harlem's 10030. So um, those are pretty much the zip codes that we live in.
Yeah, it's a very clear indication that we've become a little too lax.
Yes,
You
absolutely.
know, it's a clear indication that people have really been taking advantage of a lot of these open air restaurants. That
Hmm.
the seating is not socially distanced, and
Hmm.
you cannot eat with a mask on.
Hmm.
I remember when Bob and I went out back in August, I believe.
Yes.
We had a table for four, and
Hmm.
I was sitting on the far left to one side of the table. It was
Hmm.
four seats, and I was sitting to the far
Right.
left, and he was sitting on the opposite side to the far right.
Hmm.
And and they made sure that they didn't allow many people, because the closest table to us was more than 6 feet.
Yes.
You
Yes.
know, and so we have to really really pay attention, especially now. Again, we can't say it enough with the holidays coming, because
Hmm.
in that relaxed mode now, you will think it's okay to get together for those holidays as
Hmm.
we did back in 2019 and before.
Hmm.
And that's not happening. Last week, part of our report was how one person spread it to 25 people who were representing four different states. So we don't know how many people was infected by that one family get together.
Hmm.
The only two people that weren't infected were the two that stayed out in the backyard with their masks on.
Hmm.
So we want you to really, really, um, if we really work hard to do what needs to be done now, we'll be out of this quicker.
Hmm.
I know people are tired. It's COVID lag. But if you really want this thing to be under control, we have to pay attention now. That's the only way we're going to get out of it.
Hmm.
Can't take these chances. Keep taking these chances.
And to give this perspective, like we said, saw the rates jump in East Harlem from 0.37 to 1.5. We know that 3% is a number that the city starts shutting things down. That's what happened in Brooklyn, in some of the Hasidic areas when those rates went above 3%. They had to come in with additional measures. So the point we're making is let's not wait till it get by the time it gets to the point where the city is reacting to it. It already is happening too much, and you already are putting yourself at risk. So
Exactly.
we're giving you the early warning. And to put things in perspective, um I was on the phone with a friend of mine on Monday who's a doctor in Colorado, and they're talking about 7% and 10% rates. So yes, it is a lot worse in other areas of the country, but do not be fooled. We are still at risk here. Remember that we have unique risks in New York. We have more people in denser areas, so it is a lot easier for an outbreak to really catch and run quicker here than other places. And the reason why it's up in other places is because people are acting like idiots. We're New Yorkers. We're not idiots. We've got to use the common sense. We got to use the experience that we got in April and May and June to protect ourselves, because that's what's that's what's right around the corner. I don't even want to say on the horizon. It's right around the corner.
Right.
So protect yourself.
And at the same time, you got to realize that the numbers that we get are not like real time numbers,
Right.
because there's other people being tested may not get those numbers until next week,
Hmm.
at
And
least 4 or 5 days from now. So, imagine if you or someone that you know tests positive, or you're with them or around them or in a group of people, and all you need is one person in that group.
hmm
Just imagine how many people each one of you come in contact with.
and
And
if
you're not socially distancing and wearing masks or face coverings and washing your hands.
Yeah, our last week's live stream, we had a reporter from Will Welch from the city.nyc, and we did a whole show talking about the issues in terms of the numbers and the fact that we're looking at the fact that the numbers we're seeing still may be underreporting because of the way the numbers are gathered. If you want to dive deeper into that, please check the archives either on Facebook or YouTube, and you can listen to that, or you could just listen to us and understand that when we're telling you the rates are going up, we're still telling you that these numbers may not be telling the whole picture. So act accordingly, protect yourself. That's the short version. We should probably talk also about the new travel restrictions. So travelers to New York must get tested for coronavirus. Governor Cuomo announced the new mandate Saturday, which replaces the COVID-19 travel advisory list. So basically, anyone traveling into New York is now going to be required to undergo COVID-19 testing before and after traveling to the state. And so this is, a significant uptick in what's going on. The new policy requires anybody to test negative for the virus within 3 days prior to arrival. And then once they arrive in New York, travelers must quarantine for 3 days. And on the fourth day, get tested for the virus again. Um, and this policy doesn't apply to New York's neighboring states. So it doesn't mean all of a sudden you can't come over from New Jersey. But if you're coming from Pennsylvania, if you're coming from Delaware or Maryland or something like that, or anywhere beyond, if you're flying in, it is a much stricter standard than the travel advisory rate. And this is reflecting the fact that COVID is is going crazy in the rest of the country, and so important to know in terms of what your holiday plans are, whether you're talking about having people come in or whether you're talking about leaving to go other places. You probably need to really take a close look at what these restrictions are. You can certainly find more information on the New York State website or the governor's website, but this is where we are right now, is that we keep dealing with a pandemic that is not slowing down, is gaining speed. We've been setting records in terms of numbers of daily numbers of infection. I think last Friday was a record, and by all measures, it looks like we're going to continue to set records because the other states have not done the things that they need to do to flatten the curve.
Yeah. And again, it's suggested that you kind of just stick with the regular people, the
Hmm.
immediate family members.
Hmm.
Um, we've got major holidays: Thanksgiving, Christmas, New Year's,
Hmm.
and I know people have been away from their family members for a long time. And
Hmm.
in particular, you have family members, let's face it, that you only see maybe once a year around the holidays, you know.
Hmm.
But we're just trying to help you ensure to be able to see them around the holidays again in 2021.
Hmm.
You know, that people don't create their own private spreads.
Hmm.
You know, we have countries around the world. Bob's going to talk about where they're starting to lock down again, literally lock down.
Hmm.
Because it's starting to get vicious again. And
Hmm.
again, we're going into the cold weather. We're still in 4 different emergency stages. We're in COVID. We're in hurricane season. We're in flu season, and there are still possibilities of having blackouts. There's that
Hmm.
area in the Bronx that blacked out this week,
Hmm.
for a couple of days. So, again, we come to prepare you and not to scare you.
Hmm. And again, to put it, as you said, to put it in perspective, this is not a U.S. problem; it's a global problem. Let's talk about England. England is entering its second national lockdown in the coming days, and they're talking about a month-long shutdown going into effect after a parliamentary vote, and they're locked down. They're closing down pubs, restaurants, non-essential businesses, including hair salons and gyms. Schools, universities, and playgrounds are staying open, but people are only going to be able to leave their homes for specific reasons: education, work, shopping for food, health reasons, or exercise. But the English government is discouraging all non-essential travel, and their shutdown is going to take place from now straight through to December 2nd. And they're hoping that shutting it down a month is going to, you know, get it under control before the holiday season. And so these are tough decisions that other countries are making, and we need to pay attention to this because what we know that's been going on here is that our federal government is not making tough decisions. And that's one of the reasons why our numbers keep going up and not down. So we see that we have talked about our mayor and governor, and we've been critical sometimes about how they interact together and how that's not helping us. But we have to say that they are at least paying attention to what's happening on a macro level. We still don't feel like there's enough addressing the data that's happening in our communities, and we don't feel like the testing is giving us accurate numbers. But our governor's not sitting around waiting for the virus to get better. He's taking steps that sometimes are hard decisions to make. It's a hard decision to make to lock down travel just before the holidays are coming. Everybody wants to see their families. Everybody wants to especially in this year where you may not have seen family and friends. I can tell you personally, being on a family conversation yesterday where we're having hard uh, conversations about what we're doing for the holidays or not doing because we have, elderly family members to protect. We have younger family members who are in school and traveling, and there's a potential exposure in travel, especially in the holidays. If you're talking about traveling for Thanksgiving or traveling for Christmas, that is, a prime opportunity for super spreading. And even traveling back and forth during the holidays, if you're talking about being on public transportation, those are exposures that you may or may not want to take, depending on who's in your family, what are their pre-existing conditions and risk factors. So this is a time, we've been saying it for the last 4 or 5 weeks to get people ready to really kind of raise their alertness about COVID. And it's a stressful time overall. A lot of people have been stressed out about the election, and there's no relief on that as yet. And so people want to spend time with their family and friends, but COVID-19 doesn't care about the election results, and unfortunately, COVID-19 doesn't care about our traditional family gatherings. So, we have to make informed decisions, and that's why we're here every week, every Wednesday morning, to give you new information so that you can make better decisions.
Most certainly, this is a time when each family needs strong advocates, those that are listening, those that are paying attention, those who know that this is no joke, um, that can really get through to the family, say it's not a good idea. The wonderful thing is you've got like this StreamYard, you've got Zoom, you've got so many different ways that you can still communicate, you know. And with everything going on, you still got to make sure that you take care of yourself, your emotional health, your mental health, your physical health. You can get exercise. You can still go out and exercise before the weather gets really cold. Make sure you keep tuning up your immune. Take those vitamins, get that vitamin D, supplements in you. Um, we always talked about the garlic and onions and uh, ginger, lots of fruits, green vegetables, green leafy vegetables, where you can get that zinc, that selenium, that vitamin D in particular for African Americans, um, for people who may have underlying illnesses like lupus. We don't
Hmm.
absorb vitamin C. We can't be in direct sunlight, to get the vitamin D. But I do keep my, windows open, my shades up, and let it come into my house and absorb it that way. But I take a massive amount of vitamin D. Um, and for a lot of us, I know a lot of our doctors are not telling us about these things. We need to question them,
Hmm.
and make sure that we have the adequate amount to help us stay healthy. So that voice in the family is like really essential now. That they need to talk those older members that may want to travel and get together. That I understand. Listen, I'm a senior. I understand. We're living on the other side of our lives. We want to do as much as we can, live our best lives. But I want to live my life. That is the most
Right.
important thing. And
Right.
when you have comorbidities, when you have uh, different illnesses, diabetes, high blood pressure, those are not good things to align. COVID is not good if you're the healthiest. but you
Hmm.
certainly do not want to mix it with
Hmm.
those things. And when we see how many people have been infected, and now it's proven that you can actually have a second reinfection, or I'm sorry, a reinfection, two completely different times that this disease has invaded people's bodies. And one gentleman, I think he was from Nebraska, said this is the second time was so much worse than the first time. And he thought the first time he was going to die. So I mean, we just we can't stress it enough to not take this lightly.
And the thing that we're seeing on a continual basis is, so obviously there's been a lot of attention. The scientific and medical community over the past 6 or 7 months have really started to study COVID-19 in much more depth. So one of the things that we continually see is that COVID-19 got our attention because when it reaches its most aggressive states, it can kill people in a relatively short period of time. But what we're looking at now is the long-term effects, which we're only now starting to get more and more data on. So we're talking about heart effects. We're talking about brain effects. We're talking about digestive system. We're talking about toes. There are so many aspects that we're now seeing every week, more information about different effects. I'm going to talk about one of them in particular. We saw a story, and I'm going to actually bring that up on screen. Um, this was in Science Alert, and it's basically talking about um, research that was done on brain scans, and they're showing a whole spectrum of COVID-19 or abnormalities that they can't explain. So um, we knew early on about the loss of smell and taste, and those were the early symptoms. But we're also talking about strokes, seizures, and swelling of the brain, also known as encephalitis. These have all been described, as well as confusion, delirium, dizziness, difficulty concentrating. These are many of the effects that people have reported, and the doctors are trying to understand how it affects the brain, and they're collecting a lot of data, but it's still, a lot of it is a mystery. Here talking about a study where 420 patients did EEGs, and the most common thing that came up was an altered mental state. Close to two-thirds of the patients studied had experienced some delirium, coma, or confusion. 30% had had a seizure-like event, which prompted their doctor to order an EEG. So these are really serious issues that are happening in the body, and so it's one of the reasons. I don't know if people think that we're alarmists coming on here every week talking about it, and people talk about what they call COVID fatigue. Is that after 6, 7, 8 months of talking about this, people are just weary about it and they want it to be gone. And I can pretty much tell you that there's nobody more weary or want it to be gone than the two of us. But we're not going to ignore the information and the facts. And we're trying to get back to making decision based on real facts and real information. We're hoping that our country makes a swing toward that direction. But whether it does or doesn't, we're going to be here continually giving you the information, whether it's good, bad, or it's ugly. We are going to share it. Now, there's another story that is probably potentially good news. Now, this relates to people who have diabetes, and they have made some correlation between there are a class of drugs called statin, Statin, which they did some studies of diabetes patients who were taking statin and found a correlation between lower death rates. And we're still trying to learn more about this. I've never heard of statin before yesterday. As you know, we're not doctors; we just read a lot, but we try to read the stuff that makes sense. And so statin is supposedly has some protective measures in terms of heart health, and there's some correlation to diabetes patients having better COVID-19 outcomes when they're using this type of drug. So we will continue to kind of monitor that story and see if we can get more information. But we know that the medical community is looking at every aspect, whether it be drugs, whether it be vaccines, to try to come up with solutions. We're doing our best to engage with what we call trusted doctors and trusted medical sources so that we can sort out what's going on. We know that there's a push toward, vaccines and a vaccine distribution infrastructure. And quite frankly, we want to know more about anything that comes down in this direction in terms of safety and testing, and what were the protocols that were done before they just show up at our door saying we've got the magic solution. We're going to want to know more information about what's going on. But it's not. This is not to disparage our health system. We know that there are plenty of doctors and researchers who are trying to come up with real solutions on this, and we salute all of them. We salute all the doctors and medical professionals who've been on the front line, and we grieve for the ones that we lost over the last 6 or 7 months. People who put their lives on the line to keep us safe. Um, so we try to keep our focus on what's really going on, and I don't know what else to say.
Yeah, I mean, it continues to be a lot, but I always remember when I went into nursing school, the first thing they taught us was CYA, cover
Hmm.
your A, the instrument that you sit on.
Yes.
And so we believe that in a sense because we learned how to yo-yo, you're on your own.
Hmm.
You know, I'm not going to tussle with someone who keeps moving up on me and they don't want to have a mask on or they have it under their nose. I'm
Hmm.
not going to, debate with you. I'm going to back up. And if you keep advancing on me, I'm just going to roll off in my scooter. We have to really um, be vigilant.
Hmm.
So, um, you were talking about statins. They're like Lipitor, um,
Hmm.
actually high blood pressure. I mean cholesterol lowering diseases.
Hmm. Drugs.
Medications. Thank you.
Hmm.
Like Zocor, Lipitor, Lescor, Lipostat, Crestor. Those are all statins.
Hmm.
And for some reason, um, it apparently is something. It's not a cure. Don't think it's a cure. They just find that for some reason, people that take those type medicines have a lower death rate. They fare better than others for some reason, but it's a study that's still, ongoing. In the meanwhile, do what you can. Do what you can because there's one thing that I remember throughout this entire um, pandemic rather, that even now, before a lot of people were getting infected, it was a little different. It was a little harder to focus on a lot of stories. But people then and now are saying they did everything. They thought they did everything they could. to not get it, and yet they got it. And again, we have to remember that you can be asymptomatic. So you may go into a place and like they have some open air things going on, open street events and stuff like that. And people will go in and then they'll relax and they'll take their mask on. They get too close to people. But remember, just because they took temperatures at that entranceway does
Doesn't
not mean that that person that you're sitting with doesn't have COVID.
let's call this for what it is. Anything where they're taking your temperature, that's a cosmetic measure to make people feel good. The simple fact, and we know this to be true, is that people can be spreading this and showing no temperature. So the temperature might catch somebody who is really further along in this thing, but that's not really. It's a to me it's a false protection. It's showing that you're doing something, but you're not really doing anything. So let's just call it for what it is. And this is why we pay more attention to these numbers. And we're going to go back to if you tuned in late. Our lead story has been that the positivity rates have been going up in 6 out of 8 of the zip codes in Harlem, and we're putting you all on alert that now is not the time to be hanging out. This disease spreads by being around people, so don't be around people. Don't have anybody, you know, less than 6 feet away from you, and really try to make it 10. We want to be straight up about it. And wear the mask and make sure you're not interacting with people who are not wearing masks. And this means in the store, and this means the mask is over your nose and over your mouth, not hanging around your chin. No one, your chin is not the problem.
Right.
So wearing the mask on your chin is not going you're just wearing it to be polite. We're not wearing masks to be polite. We're wearing masks to protect yourself and protect other people. um
Your wrist, Bob. I see a lot of people wearing them on their wrist.
mhm,
It's like it's jewelry.
mhm,
You know how long it takes to get off your wrist and put it up around, even if you can't seem to keep it over your nose and mouth. Even if you do, sometimes, yeah, I relax mine when I'm going down streets. I can avoid people.
mhm,
My scooter, I can avoid people. I know all the blocks and nobody walks down.
mhm,
And so there's times when I can pull it down, but not when I'm walking down the street and there's a whole lot of people just passing me left and right.
mhm,
That's not a good time, but certainly not here. You know how long it takes to get it from here up to here, around your ears, around your head, tired or whatever you have to do? Not here. I see this in Harlem a lot. People wearing them on their wrist.
mhm.
Please wear them appropriately.
So the other thing we advise that you do now, right now it's early November. It's a good time. You need to restock up your supplies in case of another shutdown. We just talked about what's happening in England. They shut it down. We talked about our governor. He's shut down travel even tighter. We know that, in neighborhoods, they're doing kind of micro targeting, but when they see these upticks, they shut those neighborhoods down. So it is very, very possible that we could see another tighter shutdown, whether it be citywide or whether it be block by block. But the fact that we're seeing upticks in Harlem means that it's on our radar and it's on other people's radar. So now it's not the time to wait for the city to declare something to then say, oh, I got to run out to the store and get all my supplies. At that point in time, it's too late. You'll be out there with everybody else, and the store becomes a super spreader event, and you're not going to find the supplies that you're looking for. Get your stuff now, take care of yourself. And we're also advising that not just for COVID. We're still in we still are going into the winter. We still have risk of blackouts, as you talked about. We still have risks of shutdowns that are related to whatever is going to happen and how things may play out in this political situation. There is a real opportunity for unrest, no matter who is declared the winner of the presidential election. There is a high possibility of there being unrest, and that unrest means that you may, um, your best bet may be to stay inside. Are you ready to do so? Do you have the supplies? We're giving you the fair warning now, to take care of yourself. Um, I don't know how to say it any more than that.
And I know one thing I've noticed, and I'm not mad at them. Over, like I said, maybe the last 3 weeks or so, I started to see lines outside some stores in East Harlem.
Mm-hmm.
Again. So these
Mm-hmm.
were stores that had actually relaxed, and they were still keeping an eye and making sure people were distanced on the lines, and not too many people were coming in. But I'm starting to actually see the lines, which
Mm-hmm.
means going back to, if it's a small store, no more than 4 people, 5 people, 10 people, at the most in the store at one time.
Mm-hmm.
So like I said, and this is in Harlem. And if the numbers are upticking in Harlem, then we need to be on alert. That's East, West, and Central. We need to be on alert. And I'm still having people come to me and say, "Oh, well, I'm not sick. Do I look sick?" So again, I don't know what kind of fog people are in, or if they're just in denial. But again, you don't have to look sick to have COVID. You could have no symptoms and have it. No symptoms. They almost didn't let me into the clinic, and this was weird. Into my doctor. It was weird because when they took my temperature, it was 92. And so the woman got another thermometer, and it was 92. And she asked somebody else to take it, and it was 93. But I generally have that type of a temperature. Some people temperatures just register lower, but it
Mm-hmm.
just goes to show that they didn't even know what to do with me. They was like, "Well, should we let her in?" The lady says, "But she doesn't have a fever." you know.
Hey, I always tell people that Carol Johnson's cold blooded.
Okay, maybe it's true. I mean, maybe so. But my temperature always usually under 96.
Hmm.
So, but it just goes to show that they weren't even ready for that. That's what I'm
Hmm.
saying. They weren't ready for that. So they were kind of looking at me like, well, maybe she might have COVID. And the other nurse in the background was saying, she does not have a temperature. Let the lady in. So that a lot of events, I see people going out and they're getting those electronic thermometers, and they're having their get-togethers and they're testing everybody at the door. But again, that's false assurance. There's
Hmm.
everybody in that room. You could have 20 people in that room. Everybody could have COVID.
Hmm.
Nobody has any symptoms, and you wouldn't know it.
Hmm.
So just saying what we said from our first show. Our whole point is to not have to make that 911 call
Right.
and go to the hospital.
Hmm. So we remind you again, tune your immune system up. Get the vitamin C, get your vitamin D, get your zinc, get all of those things. You can get them in supplements, you can get them in food sources. Take care of yourself, exercise, get plenty of rest, stock up, and follow all the protocols. And we might sound like a broken record, but we're still here, standing here to talk about it. Um,
Hey,
use a high degree of common sense because everyone else is not going to. That's probably the most important thing because, you know, the the biggest pandemic isn't the COVID-19. The biggest pandemic is the pandemic of willful ignorance. People who just see the information but don't want to respond to it. So for every one of those people who's willfully ignorant, you have to be doubly smarter for yourself, because they're going to be doubly stupid. They're going to be stupid enough to put you at risk and themselves at risk. So you want to be doubly smarter to protect yourself and your family. And that's
That's
it.
right.
So,
And we, like, again, it's not about being fearful, but don't, what they say, fear could be false evidence appearing real. That you're listening to someone who, misery always loves company. That's a
mm,
saying that never goes away. But,
mm,
you look at somebody and say, well, they generally know what they're talking about, and I know fear is a motivator. It could even motivate you to do right or wrong. But the
right,
thing about it is, sometimes you have people that will tell you that things are okay and it's not. You have to follow your own better judgment.
right,
Because how many people have said, that's okay, I don't have to pull my mask up. But you knew better.
hmm,
You knew better.
right,
There's some people that want to relax. They don't want to be on the wrong terms with people. I don't want to get them mad, so I'm going to be in this place. I'm going to talk. Please don't. This is not the time to, like we used to say, make friends with Kool-Aid. This is not the time. We want you to be safe.
right. Because fear may be false evidence appearing real, but real is real evidence arriving late, and
Mm,
that's you know. So we're giving you the real evidence on time. Use it. So I think that we're going to wrap up here. We invite everybody to continue to stay safe. That's all we're
yes.
really talking about.
And I
Um,
just want to personally thank everyone who exercised their right, the rights that people died for who didn't even know you. If you
mhm,
didn't vote this election, make sure you vote those midterm elections and every election thereafter. I want to thank everybody that took the time that stood on those lines. Some people stood for 10 hours in some places, stood for 3 hours, 2 hours, whatever, that you took the time to participate in having a voice in this democracy. Or what was the democracy? I'm not quite sure what it is now, but you know, but thank you.
mhm,
Especially those seniors. Those seniors were out in droves. We love you and we thank you. We know you saw more than we saw when it came to exercising your rights and fighting for your rights. So it did my heart good for those that voted, for those that signed the census, that um, had concern for getting that money in that we need more than ever before into our communities for the next 10 years. I personally thank you.
mhm. And we ask you to continue to stay alert, stay ready. We're all waiting to find out how things play out, and we have no idea. It could play out today, tomorrow. It may take another week. It might take to the end of the year. We just don't know yet. But what we do know is that we ask you to stay aware and alert as you're walking around, this community, or not walking. Just keep your eyes and ears open. Protect people who are at risk, whether they be young children, elderly, people with pre-existing conditions. Look out for each other, because that's how we get through things.
All righty.
All right, we'll be back next week, 9:30 a.m. right here on YouTube and Facebook.
As always, good to be here.